Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. So, there is one thing that has become a major quest for all hair loss switchers, and that is to find a general hair growth stimulant that is better than the best one we have now, which is topical minoxidil. But this has become like alchemists trying to find the Philosopher's Stone. People have tried for years, but so far, nobody has been successful. Minoxidil was first approved as a drug for treating hair loss way back in 1988, and it's amazing to me that it's been almost 40 years and we still don't have a better hair growth stimulant than topical minoxidil. Of course, for androgenetic alopecia, finasteride and dutasteride are more effective than minoxidil, but those two drugs treat the specific cause of androgenetic alopecia, specifically elevated DHT in the hair follicles. They are not growth stimulants like minoxidil. However, minoxidil causes increased hair growth in all people who use it, even people without androgenetic alopecia. So, since the two drugs have different mechanisms, they stack together. So, combining minoxidil with a 5-AR blocker is a very powerful hair loss stack and is considered the gold standard for hair loss prevention and hair regrowth. Yet, after all this time, no general hair loss treatment has dethroned minoxidil. So, I'm always looking to see if there's any research showing that there is any treatment that might equal or even beat minoxidil as a general hair growth stimulant. So, it turns out that an old drug called valproic acid might actually be a good hair growth stimulant. Valproic acid is a drug that is used to treat epilepsy, but it turns out that it has a lot of metabolic effects that are unrelated to treating epilepsy. One of those effects is to stimulate the WNT Wnt pathway. Now, this gets pretty complicated, chubs, but if you've been watching my channel for a while, then you probably have heard me talk about the Wnt pathway before. Activating the Wnt pathway is very important for starting up the anagen growth phase of the hair growth cycle and in delaying the catagen phase that ends the active hair growth cycle. So, let's go ahead and take a look at this diagram. It's pretty complicated as you can see, but here are some of the highlights. In the cell, there are proteins that can either stimulate the Wnt pathway or inhibit it. For example, DHT in the cell stimulates something called DKK1, which stands for DICKOP1. DKK1 inhibits the Wnt pathway, so this is one way that increased DHT levels inhibits hair growth. Valproic acid, on the other hand, stimulates the Wnt pathway. This has been shown in neural stem cell models where valproic acid increases β-catenin, which is a major component of the Wnt pathway. It is thought that valproic acid inhibits GSK3-beta, which is something that inhibits the Wnt pathway. So, inhibiting GSK3-beta ends up releasing β-catenin, which is normally bound to it, and it's the β-catenin that enters the cell nucleus and causes the DNA there to produce the proteins that cause cell growth. Like I said, these cellular pathways are pretty complicated and very delicately tuned by evolution. The Wnt pathway interacts with other pathways like the sonic hedgehog pathway, yes, it's really called that, and it also interacts with other factors like TGF-beta. But the important thing to realize here is that valproic acid has the potential to increase hair growth by stimulating the Wnt pathway. Anyways, as interesting as that all may be, it's still just mechanistic data, and as I've said many times on this channel, mechanistic data needs to be verified by outcome data. There have been plenty of hair loss treatments that have looked great on paper, but then turned out to be complete bunk, much like many of the prostaglandin modulating therapies that people used to hype up, like castor oil. So, what do we know about valproic acid's effects on hair growth from clinical studies? Well, we're not off to a good start here, chums, because one of the common side effects of taking valproic acid orally is, get this, hair loss. The hair loss from oral valproic acid is diffuse, non-scarring, and dose-related. There are several case reports in medical literature of hair loss caused by high doses of valproic acid. Here's one such case report. Fortunately, though, the hair loss is reversible if you stop valproic acid, as you can see here. So, if you're taking oral valproic acid, one of the things you have to worry about is that it can cause hair loss, although it is reversible hair loss, unlike with androgenetic alopecia. However, interestingly enough, it looks like the cause of hair loss when taking high doses of valproic acid is actually due to biotin deficiency. Valproic acid decreases biotinidase activity, which is an enzyme that recycles biotin in the blood. Low biotinidase results in low biotin levels that then leads to hair loss. So, this is one of the very few, if only, circumstances where taking a biotin supplement may actually be useful for your hair. However, none of this is really a concern if valproic acid is given topically, just so long as it isn't absorbed systemically to any significant degree. So, looking at topical valproic acid, we have this study here from Good Korea. This study from Good Korea was a double-blinded randomized control trial that compared an 8.3% valproic acid spray given twice per day versus a placebo spray. The subjects were all men aged 19 to 45 years old with moderate androgenetic alopecia. They had Norwood classes ranging from 3 to 5. The study lasted 24 weeks, and the main endpoint here was hair counts assessed by a phototrichogram in a 1 square centimeter diameter area of the scalp. The study also looked at hair diameter changes in hair growth rates. In addition to that, serum valproic acid levels were measured to make sure that the systemic absorption was minimal. So here you can see that 40 subjects were enrolled in the study, but there was a fairly high number of dropouts, 13 dropouts altogether. The dropouts were because of non-compliance or other issues that we'll get into a bit later. This figure here shows an example of a patient before and after treatment. There does seem to be some improvement, but I always find these example photos misleading because I don't know if this is the average response or the best response, and just showing one subject doesn't really tell you anything. Anyways, this figure here shows the main results of the study. Clearly, the hair counts improved in the valproic acid group. The median change in hair counts was 23 in the valproic acid group and -1 in the control group. However, there were no significant changes in hair diameter and hair growth between the two groups. As far as adverse events go, 11 out of the original 40 patients had adverse events, mostly local skin irritation issues. However, there was one case of ventricular tachycardia in the valproic acid group, which is a potentially life-threatening problem. However, the authors of the study felt that this was not actually related to the medication, and they're probably right. You see, although cardiac rhythm problems can occur with high doses of valproic acid, the amount of systemic absorption was very minimal. The valproic acid levels were only detectable in 7 of the 20 subjects who got the valproic acid, and the levels even in those subjects were very low. So, the authors of the study concluded that the results are encouraging, but that further studies are needed, and I agree completely, of course. Unfortunately, though, the story of topical valproic acid almost ends right there. Subsequently, there was a mouse study that used dissolving microneedles of valproic acid as a delivery mechanism. The study showed mouse hair regrowth that was even better than topical valproic acid and much better than the control group. The study also confirmed that valproic acid works by activating beta-catenin in the Wnt pathway. However, this system has not been tested in humans as far as I can tell, at least not yet. So, this is another intriguing potential hair growth stimulant that really hasn't been fully investigated yet. Theoretically, it stimulates the Wnt pathway, which is inhibited in androgenetic alopecia by the trash hormone DHT. So, it might work quite well in people with androgenetic alopecia, but it's still not clear what the optimal concentration would be or how it would compare to topical minoxidil because there's not enough research yet. Unfortunately, it is a drug that is currently off patent, so no drug company is going to make any money from it. Because of that, no drug company is going to invest in big expensive studies to prove that it actually works. So it's yet another possibly great treatment that is stuck in drug research limbo at the moment. It looks like topical valproic acid spray is actually available online for commercial use. I don't know if any of my viewers have ever tried it, but if so, please leave a comment below because I would be very curious about this. So topical valproic acid is interesting, but I don't think it is actually going to be better than topical minoxidil. If there is any abandoned minoxidil alternative that I think does have a chance to be much more effective at regrowing hair, then it is topical cyclosporine. Topical cyclosporine was abandoned, but I think it's because the research parameters set in place for the drug were extremely unfair and made the drug look much less effective than it really is. And I made a video about topical cyclosporine, which I'll link below, so be sure to check that one out if you haven't already. So I think that if there's any growth stimulant that deserves another look, it's topical cyclosporine, not valproic acid. Although, I would be interested in seeing more research on either of them, so hopefully it happens soon. Okay, chums, I think that wraps up things for today. I'll be back with some more preem hair loss witchery in the near future, though. Until then, thank you for watching. God bless.